Hypnopompic hallucinations versus nightmares, key differences and similarities. Hypnopompic hallucinations and nightmares are both sleep-related experiences that can involve vivid, often unsettling, sensations. However, they occur at different points in the sleep cycle and have distinct characteristics. Understanding the key differences and similarities between the two can help in recognizing and managing these sleep phenomena. 1. What are hypnopompic hallucinations? Hypnopompic hallucinations are vivid sensory experiences that occur during the transition from sleep to wakefulness, typically right before a person fully wakes up. These hallucinations can involve seeing, hearing, or even feeling things that are not actually there. Common experiences include seeing shadowy figures, hearing noises like whispers, or feeling sensations such as pressure on the body. Unlike dreams, hypnopompic hallucinations blend elements of wakefulness with dreamlike imagery, which makes them feel incredibly real. This can lead to confusion and fear because the brain has not fully disengaged from its dream state. 2. What are nightmares? Nightmares, on the other hand, are distressing dreams that occur during REM, rapid eye movement, sleep, the stage of sleep when most vivid dreaming takes place. Nightmares often involve themes of fear, danger, or distress, and can cause the sleeper to wake up feeling anxious or frightened, unlike hypnopompic hallucinations, which occur when a person is partially awake. Nightmares happen while the person is fully asleep. The sleeper may or may not wake up immediately after the nightmare, but the emotional intensity often lingers even after waking. 3. When do they occur? Hypnopompic hallucinations occur during the transition from sleep to wakefulness, typically in the early morning as the sleeper begins to wake up. These hallucinations happen in the hypnopompic state, which is the period right before full wakefulness. Nightmares occur during REM sleep, usually in the middle of the night or during the early morning hours. Nightmares are part of the dreaming process and take place while the person is still fully asleep. 4. Sensory experiences. Hypnopompic hallucinations involve vivid sensory experiences that feel incredibly real. These can include visual hallucinations, like seeing figures, auditory hallucinations, hearing voices or sounds, and tactile sensations, such as feeling pressure or touch. Nightmares primarily involve visual and emotional experiences within the context of a dream. Nightmares often revolve around frightening or distressing events and usually do not involve tactile sensations that carry into wakefulness. 5. Emotional response. Hypnopompic hallucinations. The emotional response to hypnopompic hallucinations can vary. Some people experience fear or confusion, especially if the hallucination is frightening or unsettling. However, because the person is partly awake, they may also quickly realize that what they are seeing or feeling is not real. Nightmares. The emotional intensity in nightmares is typically very high. They often evoke feelings of terror, anxiety, or helplessness. When a person wakes up from a nightmare, these emotions can linger for a few moments or longer. 6. Consciousness level. Hypnopompic hallucinations occur when the person is in a semi-awake state. This means that the brain is partially conscious, blending elements of both the dream world and reality. People often describe feeling confused or disoriented during these experiences. Nightmares happen when the person is still in deep sleep. The person is unconscious and not aware of their surroundings. Upon waking, they may feel disoriented or scared, but they typically recognize that the nightmare was just a dream. 7. Causes and triggers. Hypnopompic hallucinations. These hallucinations can be triggered by sleep deprivation, stress, or certain medications. Sleep disorders such as narcolepsy and sleep paralysis can also increase the likelihood of experiencing hypnopompic hallucinations. Nightmares. Nightmares can be caused by stress, anxiety, trauma, or even certain medications. They are more common in people who have experienced traumatic events or who are going through periods of high stress. 8. Are they dangerous? Hypnopompic hallucinations. Although these hallucinations can be disturbing or frightening, they are not considered dangerous. They typically last only a few seconds to a minute and disappear as the person fully wakes up. Nightmares. While nightmares can be emotionally distressing, they are also not dangerous. Frequent nightmares, however, may indicate underlying anxiety or trauma, which could benefit from professional support. Conclusion: hypnopompic hallucinations and nightmares are both vivid, often unsettling, sleep experiences, but they differ in significant ways. Hypnopompic hallucinations occur during the transition from sleep to wakefulness and involve real-feeling sensory experiences, while nightmares are emotionally intense dreams that happen during REM sleep. Both can be triggered by stress, anxiety, or sleep deprivation, but neither is typically dangerous. Understanding the differences between the two can help alleviate fear and promote better sleep hygiene to reduce their occurrence.